Good afternoon. It's Dr. Laura Fenimore, and we are continuing our series of advanced practice nurse roles, and this time talking with a nurse midwife. Eliza-Christie is a nurse midwife here in Pittsburgh at the Midwife Center, and we are very fortunate to have Aya for a little brief bit of time in her day to share with you her journey as a nurse midwife. And Aya, you were just telling me a little bit about your journey, about how nursing wasn't your first career, but that you came to nursing and to nurse midwifery. So tell us a little bit about your journey.
Yes, thank you for having me here.
Welcome.
I grew up in Pittsburgh, and my first degree was in social work from the University of Pittsburgh. And I did most of my social work in clinical settings regarding sexual and reproductive health. So I worked at Planned Parenthood, and then I worked at a family health center, specifically around pregnancy. And I realized that I wanted to learn more about how to support people throughout their reproductive lifespans, and became a doula. And I was a doula and social worker in different capacities for several years, and then knew that I wanted to be a CNM after learning about Pennsylvania law and what kind of midwifery would be an option to practice in the state. And I decided that I wanted to be a CNM so that I felt like I would be able to have the broadest ability to practice in Pennsylvania at this time. And so I went back to Pitt and did the accelerated BSN. And that fit really nicely for my life to be able to parent. And at the time I stopped other work, but really was able to dedicate that time to my BSN. And I became a nurse only to become a CNM, but I loved being a nurse. I really, really loved being a nurse, and I'm very proud to be a nurse and very glad that I have that. I had bedside nursing experience for 5 years while I was working on my master's, and was able to work full-time parent and go to school part-time for the last 2 years that I was working as a bedside nurse. And I went to Frontier Nursing University because it was all online, and that fit my life really well. I graduated from Frontier, and now I started a fellowship at the Midwife Center, and felt really supported and mentored to be able to be with skilled people who had a lot of experience in out-of-hospital birth, as well as hospital privileges and how to manage a low-risk pregnancy and co-manage when complications of pregnancy arose. And we practice full scope midwifery. So I also do gynecologic, reproductive, and sexual health care, as well as perinatal care.
Has the position at the Midwife Center been your primary nurse midwife position, or did you practice in a hospital before that?
No, after my fellowship, I became a staff midwife, and that's been my only position as a midwife. And it's a combination of out-of-hospital as well as in-hospital care. So if clients develop complications or electively choose to be in the hospital, that has changed. But when I first started, there was the option to plan a hospital birth and have us be the care providers. So I really liked that. I liked being able to follow clients throughout their journey. We're the largest freestanding birth center in the country, so our focus is on caring for people who are choosing to be outside of a hospital, because there are wonderful midwifery groups at the two big hospital systems in Pittsburgh. So we refer folks to them when they know that they want or need a hospital birth. But for people who don't need that and want the experience of being outside of the hospital, we're one of the few options available in the region. So that's been our prioritization. So it's, I really am very grateful for the mentorship from the midwives who were my preceptors and are now my coworkers. And the skill of recognizing what is low risk And I think we have very clear distinction about when something is questionable or when a risk level is elevated. And that's a skill that I think sometimes gets lost when the presumption is that there might be a complication.
What do you like about being a nurse midwife?
I love the relationship that we build with clients. I think nursing as a foundation trains all of us to really care for the whole person and the whole family unit. And that extends into being an advanced practice nurse of any kind. And in midwifery, so much of the focus is taking care of somebody, or offering care, I should say, as it regards to their plans, their goals, their relationships, as it pertains to their reproductive life plans, either preventing a pregnancy, at times ending a pregnancy, or preparing for a birth. And so that's the same person over and over again. You know, I get to care for the same person at different points in those decisions. And I've had the good fortune now to get to be with people over multiple pregnancies.
Nice.
Get to be with people in pregnancy and outside of pregnancy, and see how that span and those decisions and points in their life kind of add up to a whole experience.
That sounds really fun. Tell us about what a typical day looks like for you, because I would imagine that unlike other advanced practice roles, this isn't a 9-to-5 job.
Yeah, the schedule of a midwife is definitely a one-off or an outlier among APRNs. So there really isn't a typical day. When I'm on call, I work typically a 24-hour shift. In the context of COVID and wearing a lot more PPE, we did change to 12-hour shifts. But I carry my pager, and I might get paged for any number of things. That might be a breastfeeding concern. It might be a concern about a potential miscarriage. It might be somebody in labor. It might be somebody who isn't in labor but really wants to get into labor, and can I help them get into labor? It might be somebody with a problem that they need some urgent examination. And then my office days are typically 9 to 5. So that's a little bit more routine. And again, I'm seeing people for all different kinds of visits. Maybe placing an IUD, doing a postpartum visit for somebody, and paying attention mostly to breastfeeding. Might be a first prenatal visit for somebody who's 10 weeks pregnant, or it might be somebody who's 39 weeks pregnant and would love to learn about how we can help move that process along.
Wonderful. So do you have to have experience as a maternity nurse before you can become a nurse midwife?
No, you don't need to have that experience. Some of my colleagues went straight from getting their nursing degree into a midwifery program. Most of the programs have bridge programs for people who have associate's degrees in nursing, even if that's something that people want to do. I was glad that I had the experience, but talking to some of my colleagues, they're really glad that they were able to kind of come with a fresh perspective and be consistently in the kind of the mindset and the frame of midwifery. So I think everybody kind of knows what is best for them, and either way is a wonderful way to enter into the profession.
Great. So how about scope of practice from the perspective of, are you working with an obstetrician? Are you working under an obstetrician? Or are you completely independent? Talk about that, especially in Pennsylvania.
Yeah, for people who want to stay in Pennsylvania, the state of Pennsylvania requires a collaborative agreement with a physician. And so that does not mean that the physician is supervising you. So the collaborative agreement that we hold with our backup physicians simply states that they are aware that we maintain our credentials, that we maintain our training and certifications, and that we are reliable, trusted providers. So there's nothing that we have to necessarily report to them. Under normal circumstances, pre-COVID, they were the physician group that we would consult with if there was an elevation of a risk factor for a client and we needed obstetrical care, or wanted to determine if this was something that was still appropriate for our practice. That's changed a bit as a lot of practices have changed.
Indeed.
So there's still, I think any provider needs a robust list of referrals and collaborating providers. I don't see it as much of a barrier as some of my colleagues with a lot more experience who kind of see what that's like. I still consider myself a newer midwife. I've been practicing about 3 years. So I have not experienced that need on the state level as a barrier to my practice. Most of that is thanks to my colleagues who've been doing this longer and have figured out how to make things seamless for client care. I think there's a lot of good work being done at the Pennsylvania chapters of the American College of Nurse Midwives to make sure that for other groups of midwives who are experiencing barriers, that we're figuring out what is the best practice for care. And what makes the most sense. And there are necessary changes that are happening at the state level.
Great. So if a new nurse or a nursing student wanted to learn more about the role of a nurse midwife, where would you tell them to find out more information? Should they watch Call a Midwife, or what should they do to learn more?
I would recommend looking at the American College of Nurse Midwives website. This is National Midwifery Week, so there are a lot.
Congratulations!
Thank you. There are currently a lot of webinars. I imagine all of them are being recorded and will be available outside of their live recording times to learn about the different ways to practice as a nurse midwife. That's a great place to start, I think, is the American College of Nurse Midwives website. And there's a lot of avenues you can go down from there.
Very good. If you were going to offer some advice to a nurse who was interested in being a nurse midwife, what advice would you give them?
I would say, I would be available for anybody who has any questions. You can contact me through my work email, and I can give that to Laura to pass along. I think talking to somebody who's doing it, it is an incredibly rewarding job. It is an incredibly weird job. And the hours and the circumstances are very specific. So I think for a lot of people, like just knowing that that's right for them is the first piece of it. I think spend time in birth. If you haven't attended a birth before, I think see if there's ways that you can provide support for people. A lot of people I know have dabbled as a doula, if not practiced as a doula for a while, and that kind of was their avenue to becoming a midwife. There's lots of opportunities to do that with I think just like weekend-long trainings or some readings if people are interested in that.
Excellent. Very good. Well, thank you so much. Your enthusiasm for nurse midwifery really comes through as you talk about your role, and I'm so glad that you chose nursing and chose nurse midwife as a advanced practice role. I'm sure that your clients really appreciate your support, and we do too. So thank you so much, Aya, for sharing your story with us. I'm sure that you'll be getting some emails from students who would love to come and shadow and see what you do.
Absolutely. Thank you for your time.
You're welcome. Thank you.